Test one, two, three. Test one, two, three.
Good morning. On this beautiful PEI first day of September. Before I get into the update, I'd like to start by thanking Islanders for your kindness, for your patience, and your understanding as we have taken this journey together through the last 6 months of the global pandemic here in PEI. I know this journey is far from over, and we will be in it for a while. But I appreciate the tremendous efforts of Islanders, of so many, who have done so much, but have also had unintended impacts on their personal lives, their families, the community, and right across the province. But today I'm pleased to report that we have no new cases of COVID-19 in PEI, and all 44 cases of COVID-19 are now recovered. So that means we have no active cases of COVID in Prince Edward Island. And a week from today, we know the students will be going back to school, and we have teachers and staff getting ready for the reopening of schools this week. And this school year will be different, and it could be a challenging one. And it's normal for parents, students, and staff to feel anxious about going back to the classroom. And I certainly can relate to that. But PEI has the ideal conditions for safe reopening of schools: low community prevalence of COVID-19 and extensive preparation by the education system to welcome back children to school. And while we cannot predict what the 2020-21 school year will be like, we know that Islanders can do our part to support students, parents, teachers, and school staff. And everyone can take steps to protect ourselves and others from COVID-19 by following public health measures like washing our hands frequently, maintaining physical distance, staying home when we're sick, keeping our circle of contact small, and wearing a mask when in closed public spaces. And these layers of protection will lessen the impact of COVID-19 on our communities and in our schools. So our behavior in the next few weeks will be very important, and the best way to support our students is to work together to follow public health measures. We know that testing, early detection, contact tracing, and isolation are crucial in containing the spread of COVID-19. And we've seen how these measures have been effective in limiting the spread of COVID-19 and its potentially devastating impacts. Work is continuing to improve access to COVID-19 testing across the province. And improved access will mean Islanders with symptoms will not need an appointment and may not need to call 811 in order to be tested for COVID-19. Instead, there'll be options for drive-in and drive-through access to testing. And I know Health PEI work is underway to establish these clinics going forward. Last week, an additional one was established for essential workers, and that will continue in terms of planning in the days ahead, and more details will become available, and Marion may speak to it as well. As I spoke about yesterday during the education segment, at this time, based on our epidemiology, the household contacts of an individual who is awaiting COVID-19 test results do not have to self-isolate. For example, if a child is sent home from school or a child care center due to a symptom of COVID-19, a parent or guardian will have to stay at home as the child cannot self-isolate alone. But other household members and other parents, siblings, do not have to self-isolate while the child is awaiting test results. However, any other members of the household are expected to take precautions, and that means wearing a mask and monitoring closely for any symptoms of COVID-19 until the test results come back. And this change, again, is based on our local epidemiology of COVID-19 and will change if we have more cases of COVID-19, including community transmission. And I'm pleased to say that Islanders will be able to access their negative COVID-19 test results online by September the 3rd. And electronic access to negative test results along with improved access to testing, will result in a much faster turnaround time from the onset of symptoms to receiving test results. As I've said before, living with COVID-19 is a long-term commitment. We're preparing for a second wave of illness this fall that could be worse than the first wave. And although we know COVID-19 has not gone away and can come back at any time, we have been successful so far in reopening our province. We've not experienced widespread community transmission, even though we have eased measures by allowing our family and friends from Atlantic Canada to visit our province. We've also increased visitation for our loved ones in long-term care, and as of today, we have increased capacity in childcare centers to 100%. We've resumed many sport and recreational activities and allowed people to gather in larger numbers at churches, events, and in restaurants. And our new normal that we're looking forward to will be in effect until the spread of COVID-19 is broadly contained and a vaccine or effective treatment is available. And moving to what we are calling a new normal is affected by several factors, including the transmission of COVID-19, making sure it's contained, that the health system, including public health, has sufficient capacity, the risk of spread within vulnerable populations is minimized, and the risk of importation of COVID-19 into our province continues to be managed. And provided these conditions continue to exist, effective October 1st, I hope we can further ease restrictions in the following areas. Gatherings of over 50 people with no limit on the number of cohorts, with an operational plan required for any gathering of over 50 people. Personal gatherings and group seating of up to 20 people. And based on certain precautions like active screening, enhanced cleaning and records for contact tracing, strict physical distancing will not be required during sports and recreational activities. And it will be up to each organization to determine what activities can be modified or limited, recognizing that some activities present more risk than others. And border screening will remain in place until at least early 2021. And isolation will continue to be required for individuals who travel outside the Atlantic bubble. This new normal, starting October 1st, will be in place until such time as the epidemiology of COVID-19 in PEI and elsewhere requires the return of further restrictions or allows for additional easing of measures. And in terms of long-term care, I think Marion will speak to more specifics around the details of long-term care. I'd like to mention in terms of international students, to date, 265 international and domestic out-of-Atlantic bubble students have arrived in PEI prior to returning to classes. 26 have already completed their self-isolation at a Charlottetown hotel, and 83 remain in self-isolation at a designated facility. The remaining 156 students are self-isolating in private residences based on pre-approved plans. We are expecting up to another 130 international and domestic out-of-Atlantic bubble students to arrive in PEI. The participants in the Canadian Premier League Island Games have all been tested 4 times for COVID-19 since arriving in PEI, and all tests were negative. And Soccer PEI, in collaboration with the Canadian Premier League, submitted an operational plan to allow up to 50 people, mostly minor soccer players, to attend the games at the UPI soccer pitch. And there will be no interaction between the island spectators and the CPL players, but this plan allows young, keen soccer players to experience a professional soccer game very close to home. And the first group of young people attended the CPL games on Saturday, August the 29th. Although we often think of January 1st as a new beginning, I feel in many ways the same as we come into September. It's an exciting time, comforting, and we are getting back into new routines or old routines. I encourage island families with young children to enjoy the last few days of the summer vacation prior to school starting next week. We can show that we care for each other by following public health measures. So please continue to be kind. Please continue to be patient. Thank you, PEI. I'll turn it over to you.
Good morning, everyone. Welcome back to schools, to all the teachers and staff who start back today. Although I know many custodial staff and administrators have been working hard over the past weeks and months preparing for the school year coming, and my two girls are anxiously anticipating and excited for the beginning of school. So thank you to that group of staff and professionals for making this year happen. From Health PEI, testing for COVID-19 continues to be an important part of the response, and we are expanding the access to testing for Islanders. Last week, as Dr. Morrison mentioned, we established a new unscheduled drop-in COVID-19 testing clinic in Charlottetown in the Eastlink Center parking lot. This testing clinic runs Monday to Friday from 8 to 5 p.m. While this clinic currently offers testing for essential workers, we plan to expand the service to all those who need testing in the near future. We are planning as well for more timely and more broadly available unscheduled drop-in testing locations in West Prince and in Kings County. And we hope to have some more details in the coming week for those available testing locations. We're also planning for more online solutions such as self-referral for testing and also information about what is open and when for our available testing locations across the province as more become available. It is important to remember, however, that we continue to follow the testing criteria for individuals who require testing, which is of course set through the Chief Public Health Office in conjunction with our laboratory. In total, yesterday, 259 swabs were taken in our Charlottetown, Summerside, and Borden testing sites, and that includes 84 swabs at the unscheduled drop-in site in Charlottetown. More services continue to be reinstated throughout the month of September, and this will include further routine cancer screening such as Pap screening clinics and colorectal screening clinics for asymptomatic and average risk individuals. The services reinstatement team continues to evaluate all plans to reopen services regularly. For visitor protocol, we have updated again our protocol, and we now have one in place effective today at all Health PEI hospitals, clinics, and our long-term care homes. Visitors are now permitted across Health PEI to support patients, residents, and families while balancing public and staff safety. There is now no daily limit to the number of visitors allowed at our sites. Visitors must follow all infection control precautions relayed to them by staff, including maintaining physical distancing between themselves and patients or residents and staff. For those at end of life, there is no limit to the number of visitors that may be at the bedside. For long-term care, residents may have visitors in designated visiting spaces, either indoors or outdoors, with no limit to the total number of visitors. Long-term care residents may also now name up to 3 people as partners in care. Partners in care are not visitors, but are people who support the care of the resident and may be with the resident at any time. Partners in care may have physical contact with the resident, and this includes contact to help with personal care as well as emotional support. Partners in care can give the resident hugs, hold hands, and provide that physical contact for residents and families that they have been needing. Outings with a partner in care are also permitted, and certain precautions must be taken for these outings to maintain the safety of everyone. Instructions will be provided to that partner in care by long-term care staff or directed by the long-term care physician or nurse practitioner. We know that people have wanted these changes and opening up of our restrictions for a long time, and thankfully, due to the lower risk of COVID-19 right now and our strong public health measures and everyone's cooperation with those measures, we're able to move forward with these changes, which are so welcome by everyone. Thank you for your cooperation throughout this whole pandemic. Please remember to attend your appointments and seek care if needed, and remember to bring and wear a mask or face covering to help protect everyone. Thank you.
Thank you, Marion. And we'll open it up to the media for questions.
Catherine Fleury, La Voix acadienne.
Bonjour.
Oui, bonjour. J'ai une question en français pour la docteure Morrison. Pouvez-vous répéter les informations concernant le retour en classe?
La retourne en classe, alors, on a beaucoup fait des préparations avec le système d'éducation et les écoles. Et puis, je sais que les étudiants, les enseignantes et les autres administrateurs préparent pour une année qui est peut-être un peu plus différente que des autres, mais ils se préparent bien, ils vont faire des choses avec plus de masques, ils vont faire plus de nettoyage, faut pas aller à l'école si vous êtes malade, et toutes sortes de choses. On a des plans en place et c'est une bonne temps de retourner à l'école parce qu'on n'a pas de cas dans la communauté à ce moment et on n'a pas beaucoup de transmission. On n'a pas de transmission communautaire à ce moment. Alors, c'est les conditions vraiment idéales pour retourner en classe. Et puis, je pense que les écoles, le système d'éducation ont besoin de notre support dans les prochaines semaines.
Parfait, merci.
Nicole Williams, CBC.
Hi there. Dr. Morrison, I'm wondering if you just could quickly clarify something for me. So these new rules around the self-isolation and the household, is this just for households of students, or is this rule for all households, meaning like anyone, even if it's just someone in their home that needs a test result, then other members of that household won't need to self-isolate as well? I just want to clarify that.
Yes, so thank you, Nicole. So yes, that's correct. I mean, if your partner has symptoms of COVID-19 and goes to get tested, and they will wait at home. They have to self-isolate, of course, until the test results come back. But Nicole, you could stay at work, but you would wear a mask and you'd watch very closely to have to make sure that you don't have any onset of symptoms. So it's trying to recognize our epidemiology in the province at this time, and of course that can change. But trying to recognize that parents, families, and also need to work, and trying to balance that out. And of course, as we talked about yesterday, if anyone is positive, then immediately all close contacts would have to self-isolate and be tested.
You. And I'm wondering if you could also just walk us through exactly how the electronic results will work.
I think it's something that we've been working on for some time, and really great support from our ITSS partners and Health PEI. And because at this point in time, people are being called and having to really wait for a call from public health nursing, for instance, to go give them their negative test results. So these results will be online. They'll be, when they start going for their tests on Thursday, they'll be giving an information card sheet that is both in English and in French, so that they can get the details of how they can access it. They'll need to put in, for instance, a health card number with the expiry date, certain pieces of information that will mean that they can see those negative test results. And I think that will help in terms of that turnaround time, because it's difficult for the nurses to get through and make hundreds of calls, a couple hundred calls a day. And so I think this will help Islanders get the results more quickly and more efficiently. And then, of course, as I mentioned, having that increased access and availability of testing will also be useful, so the whole thing will take less time.
Thank you so much.
Tony Davis, CBC.
Hello. Last week it was said, you hope the drive-through clinic with no appointment would be set up by the start of the school year. Today it was said that will be set up in the near future. I guess is it still the hope to have this drive-through clinic set up at the start of the school year, given that it's only a week away?
Yes, I think that is, and Marion is also nodding, yes, that is the intention, that is the plan, and that is the goal. And certainly recognizing that this is going to be important, not just for schools and daycares, but right across the board. And it will also, the goal is to have testing, better access at eastern and western parts of Prince Edward Island too, which has also been a goal of going through this. So to improve access in terms of getting the test done and not having to rely on 811 and appointments, and because there's some natural delays there, but also improving access in terms of location here in Prince Edward Island.
Okay, thank you very much. Additionally, you said today, 130 students from outside the Atlantic bubble were, headed to the island. Where are those students going to, since, they can't stay on campus with others going to be there soon?
So international students are self-quarantining in a hotel facility, and those outside the Atlantic bubble may be in a residence or an approved, if there's a self-isolation plan that's approved, they may be in an apartment, for instance. But the international students are treated a little differently than the outside Canadian bubble students, but in terms of where they're staying, but they all are in self-isolation for 14 days.
Okay, thank you very much.
Dave Stewart, The Guardian.
Good morning. I think this may have already been answered, but I will ask just in case. I know the rapid testing clinic at East Link Center is scheduled to run out on, or I guess close on September 30th. Do we know when, where the location will move to?
Speak to that.
Yeah, we haven't, hi Dave, we haven't confirmed or publicly announced the location yet because there still are a number of site preparations to be done at that location before we open it up. But it will be within the Charlottetown city limits. And so we are in adding these other testing locations for drop-in testing across the province, preparing to make that move to the other site and also have additional drop-in testing at that new location.
Okay, thank you. And I guess as a follow-up, I guess just we've seen a bit of a move in the business community, most recently, I guess, with Loblaws on August 29th, bringing in a mandatory mask policy. And it seems to be we're edging toward mandatory masks. Just a reaction from, either one of you on that fact, and whether perhaps this is a sign that we're sort of edging towards a mandatory mask policy from your office.
I think you're right. We've certainly talked about masks and the evolution of the science and evidence behind masks over the last number of months. We know that masks provide one layer of protection. They do not replace other public health measures such as physical distancing and hand washing. We are learning, we know that masks can reduce the transmission, though, of COVID-19. And as you mentioned, there's different retail locations and certain parts of the country that have made masks, non-medical masks, mandatory. And we've said right along that if we need to make them mandatory here, we will, right across the board, and it would be for indoor spaces. But we also have to balance that with our local epidemiology. And right now, PEI is in a fortunate position. We don't have widespread community transmission, but we're watching carefully what's going on around the country. And we think that this is a really good opportunity to do good education about how to wear a mask, when to wear a mask, why it's important, and get used to it. Because at some point, certainly if we start to see a second wave or increased cases here, it may need to be mandatory, and we've talked about that here before.
Thank you very much.
François-Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. J'aurais une question pour vous en français. Pourriez-vous préciser les règles entourant l'isolement des proches des gens qui doivent subir des tests de dépistage? M'expliquer un peu pourquoi ce n'est plus nécessaire pour les personnes qui vivent dans la même maison que des gens qui doivent subir un test. Pourquoi ces personnes-là n'ont plus à s'isoler maintenant?
Bonjour et merci pour la question. Et c'est vraiment que à ce moment, et puis ça peut changer n'importe quand, mais à ce moment, on n'a pas des cas ici avec grande transmission communautaire. Alors, on sait que on veut que les personnes travaillent quand ils peuvent, les autres élèves, les frères et sœurs de quelqu'un à l'école, on ne veut pas que tout le monde retourne chaque fois et attend chez eux pour 2-3 jours. On veut qu'ils portent un masque, qu'ils lavent les mains et puis être très prudent qu'ils n'ont pas des symptômes eux-mêmes de COVID-19. Et puis, on sait que si on ne fait pas ça, c'est un grand impact sur la famille et sur les personnes qui travaillent, puis les élèves et les étudiants dans cette famille. Alors, c'est comme toutes sortes d'autres choses qu'on fait avec cette pandémie, c'est une balance et ça peut changer.
Sur un autre sujet, Dr. Morrison, à partir de jeudi, vous allez donner des résultats en ligne. Est-ce que je comprends bien, ça veut dire que les gens de votre équipe ne vont plus contacter individuellement chaque personne par téléphone? Comment vous allez assurer que tout ça va se faire de façon confidentielle toujours si les résultats sont en ligne?
C'est notre bureau, les infirmières ne vont pas contacter chaque personne. Sauf que si c'est un cas positif, moi ou mon bureau vont faire le contact tout de suite. Et puis, c'est pour cette raison qu'ils travaillent tellement fort avec les ITSS, les supports, pour s'assurer que les résultats sont privés, les résultats négatifs qu'ils peuvent accéder sur online. Et puis, il y a aussi, s'il y a des personnes qui n'ont pas d'accès ou ils n'ont pas peut-être une carte de santé ici à l'île du Prince-Édouard, on va les appeler quand même. Alors, on va toujours faire quelques appels si on a besoin. Alors, je pense que ça a pris un bout de temps pour que tout le monde s'assure que on n'a pas de problème que ça soit privé, que ça fonctionne et j'espère que tout va bien à partir de jeudi.
Merci beaucoup.
I think that's it. So thank you very much.